Facebook. Congress has returned from its August break. The recess was dominated by debate on a proposed health care bill. Some lawmakers are saying Congress will pass a health care bill this year. Many Democrats have been pushing for a public option to be included in it. In this week's commentary, Jason Rosenbaum looks at the idea of the public option and arguments for and against it.
For weeks, the nation's political elite has been transfixed on rowdy debate over the future of healthcare in this country. Town hall meetings have at times turned into ultimate fighting matches, complete with heated emotions and a bit of screaming. But the time for theater is nearing an end, and as legislators go back to Washington, major decisions will be made on competing healthcare plans. There's been plenty of contention over the establishment of a government mechanism that would provide insurance to potentially millions of people. Congressional Democrats and President Barack Obama have positioned the so-called public option as a way to beat down the power of private insurance companies and provide people with a ticket of sorts to pay for health care. Republicans have been almost universally opposed to the public option. Among other things, they feel the move is an expensive governmental intrusion into the private sector. America, however, crossed the governmental Rubicon when President Lyndon Johnson signed Medicare and Medicaid into law. And Republicans certainly didn't lessen the governmental thrust when they passed a prescription drug expansion into Medicare earlier in the decade. But that doesn't mean the public option is a potentially fail-proof elixir. The plan, for instance, is being touted as a way to shift the uninsured away from the emergency room and into the doctor's office. But that brings up an important question. If potentially millions of people start using government insurance to get care at doctor's offices, will there be enough medical professionals to meet the demand? When posed with that question, Senator Claire McCaskill said she had a concern about primary care doctors. McCaskill said part of the goal is to provide preventative care that could forestall future ailments. I don't think right now we may be as equipped as we need to be with primary care doctors, said the first-term Democrat, but that may be a consequence we may need to look at down the road. Solving that potentially problematic issue might not be easy. Becoming a doctor, a nurse, or any other type of medical professional is a time-consuming and expensive process, and pumping out more could require infusing significant resources to expand programs at colleges around the country. And other possibilities, such as relaxing restrictions on foreign doctors, would almost certainly result in strong opposition. Until legislation is sent to Obama's desk, all of these scenarios remain trapped in a political vacuum. Lack of legislative action could result in big problems for Obama and Democrats for the next election cycle. But it's fairly clear that there will be consequences even if legislation is successful, and dealing with them could be more important than gaining a short-term political victory. I'm Jason Rosenbaum.
That'll do it for this week's Talking Politics. Remember, podcasts of this show and all of our shows are available at KBIA.org. Thanks for listening. I'm Sarah Whitmire.